everybody. Welcome to Just Upright. This is Dr. Jane Ruder, Doctor of Physical Therapy, Certified Dementia Practitioner. Today I have a very special guest, guys. I met her in our, actually she was virtual, I was in person, in a business training in our Smart Success Healthcare Business Training in Florida. And Sarah is her name. She's great. She's wonderful. And she's a physical therapist specializing in headaches, dizziness, and TMJ problems. So I don't know if you've watched some of my social media posts. I had root canal 1.5 months ago. I had limitation of movement of my jaw, and now I'm having ringing in my ear. So she is one of the instruments for my healing journey to that. And she has her company, and she will be having a boot camp soon. So we want to invite you all to that. But first, let's welcome Miss Sarah Gibson. Hey, Sarah.
Hey, Jing. Thanks for having me.
Yeah, sure. So, Sarah, let us know what's the name of your company.
Sure. It's called DizzyDoc,
Okay.
LLC. Yeah.
Okay. And how long have you been a physical therapist?
For 17 years.
17 years. And so, share with them what you told me about what led you to the path of helping people with dizziness, TMJ problem, headaches. Share with them your story about that.
Thanks, Jing. Yes, I'd be happy to. So 17 years ago, I started as a PT, and the place I was working asked if I wanted to get some specialized training as a vestibular therapist. So that's how I started my career as a vestibular PT, helping people with dizziness. And then carried along that path, a few different locations I've lived, but then became more of a manual therapist, specializing more in like neck pain and headaches, etc. And then about 11 years ago, I personally ended up with a bad case of cervicogenic dizziness after a dental visit, similar to your story, where I woke up at 6 a.m. following the dentist visit, just spinning. The world was spinning like a top. And I was like, what is going on? I knew quickly it wasn't like a vestibular problem. It wasn't a BPPV or something with my vestibular system. And as a vestibular PT, I knew this was different. So it took me down a little different path, and I had to see several doctors, as many people do, that suffer from dizziness, especially chronic dizziness. They might have gone to 5 to 10 practitioners before they see me. So I kind of started that journey, ruled out a lot of major things, with a neurologist, a cardiologist, an ENT. And then finally, the ENT was the one that said, fix your TMJ, you'll fix your dizziness. And I said, what do you mean TMJ? I don't have TMJ. I had no pain. I just had some clicking in my jaw, but no real pain. But actually, it was an underlying cause of TMJ that subluxed my TMJ joint, and I ended up with kind of debilitating dizziness for about 3 months. And so thankfully, as a PT, once I kind of knew it was my TMJ, I knew who to contact. And there was a TMJ specialist PT that I knew, and a TMJ dentist specialist. So quickly, I was able to get on the right track, and it took just about 3 months. But as I've done this now for 11 years, a lot of people, they don't know the right context, the right people, and it might take them 10 people and, years. It's just, I have a Facebook group, Dizziness, Neck Pain and TMJ, it's called, and there's hundreds of people, 400 people in the group now, and some people have been dealing with this for 10 years, with no resolution. So I've started these boot camps and also one-on-one consultations as well with people. But that's really my goal, is just to short circuit that train where it takes to get to, diagnosis. It's so long for people, and try to get them on the right path sooner.
Yeah, for those of you guys who don't know about the cervicogenic headache, so that is cervical is neck. It means neck. Okay, genic. Where is it coming from? So the headache that you might be experiencing, the chronic headache, might be coming from the neck, because the neck a lot of nerves are coming from the neck going to the head, that innervates the head, and because of improper posture, texting, computer, and we're all like this. So we have the forward head posture that pinches the nerves at the back of the neck. Okay, so that can cause headache, and just like Sarah said, if you have, like me, I had a dental workout done. They prop my mouth open wide for the entire duration of the treatment, and that I think traumatized my jaw, my muscle tense, because it was, they're drilling and, painful. And so I think that traumatized my jaw as well. And then after 1.5 months, now I'm dealing with ringing in my ear. Okay, so unfortunately, there, just like Sarah said, a lot of people don't know what's happening, cannot understand what's happening, and don't know who to reach out to. Okay, so if you are having problem with headache, chronic, constant headache, the room is spinning, or you're having clicking, painful opening of your jaw, Sarah is the right one for you, because she will give you the clinical advice. This is her expertise. There are lots of different types of physical therapists. I haven't, Sarah, really, I haven't met anyone specializing in TMJ. We studied this in school.
Yeah,
and for me,
it's a specialization, sure.
Yeah.
I think a lot of people too, as a PT, they're either a vestibular therapist or a manual therapist. They're not usually both. So oftentimes as a vestibular PT, you'd have to refer out if it's a cervicogenic or a manual problem. I know there's a husband and wife team in Maryland as well. One's a vestibular, one's a manual, so they work well together. But it's nice to have both. And then if it's not cervicogenic, I can go back and forth with the vestibular treatment as well. So the cervicogenic and whatnot treatment is usually pretty quick. You see improvement pretty quickly. So if we don't see improvement, then we can always switch gears to the vestibular treatment.
Yeah,
it's a complex diagnosis. Easy treatment, but complex to get the diagnosis, and that's where I think a lot of people get stuck. Seeing a lot of practitioners doing every test, and there's not like one test that shows it. It's a diagnosis of exclusion. They have a couple tests, but they're not very good and conclusive. So I think that's where people get stuck, chasing the diagnosis for a while.
Yeah, because as a patient, it's so hard to find time to go to different doctors to set an appointment. It's so taxing to do that. Yeah. And then if you don't find the answer, sooner or later you're going to give up. Because no one can give you the solution that you're trying to find, So for viewers, vestibular, when we're talking about vestibular, it means the inner ear problem, okay? So your balance, many people do not know that the ears are involved, very much involved in our balance, or when you hear it, equilibrium, sometimes it is termed. So if there are problems in the anatomy of the ear inside, it can cause dizziness. Okay, so just like Sarah said, not all physical therapists are equipped to handle this kind of situation. Some physical therapists are just specializing in the ear problem that causing dizziness and imbalance. And some therapists are just manual therapists, meaning they will do some, soft tissue manipulation, massage, release of the muscle, joint mobilization to help with your neck issue that's causing your headache. Sarah is both, okay? So she can actually help you determine along the way of the treatment, okay, where is your dizziness or your problem is coming from, okay? So Sarah, what is your location? Tell them your location.
I'm in upstate New York. Yeah.
Okay. Yeah. So with the boot camp, at least you don't have to go to New York if you're not from New York. She's gonna have this 3-day boot camp this coming week. And if you are a person suffering, especially for a long period of time, and you wanna know the answer to the problem that you're having, it will be highly valuable for you to attend the boot camp, okay? Okay, Sarah, so tell us about the boot camp.
Yeah, so the boot camp is 3 days, kind of condensed material. So people have it as a reference as well afterwards with a PDF. So always to refer back to, but I just wanted to kind of give everybody a basic foundation. Number one, clarity on diagnosis is the first day. So, what's causing this dizziness? And we want to make sure it is in fact coming from cervicogenic, the neck, or if is it coming from the inner ear, with the BPPV is real common there. Or is this something else? Neurologic, we'll rule out, or cardiovascular. So there's different warning signs for different things. So the first day is really clarity of diagnosis. So hopefully after day one, they know what is causing their dizziness. Or where to go for additional testing as well, if not. And then day two, we talk a little bit about what's causing this dizziness, so different triggers that are happening, and we'll touch on a little bit of some mobilization treatments. And then day three is sort of like the icing on the cake, if you will, the strength and stability exercises to keep this from recurring. So everyone's big fear is that this is going to happen forever and they're always going to have this problem. And so really getting through the strength and stability training is what prevents future outbreaks of dizziness. So it's kind of all in one, encompassing. So hopefully by the end of the week, they really know what it is, what they have, and what to do about it.
Okay, so it's going to be May 3, 4, and 5. Is that correct?
Yep, at 7 o'clock Eastern, and it's all recorded. So if you can't make it or whatnot, it's okay. You'll get the recording with it, and also a PDF of all the information slides.
Okay, so Tuesday, Wednesday, Thursday, May 3, 4, and 5, 2022. That is the current schedule right now. So if you watch this and you say, oh, Dress, I did not make it. We'll have the information, the website of Sarah on the description section. And right now, Sarah, just tell them your contact information. How can they get hold of you in case that they cannot make it to the bootcamp this coming week?
Sure. So the website with more information is called defeatingdizziness.com. And you can always email me if you have any questions or anything at drsarah@thedizzydocpt.com. So we could put that in the comments. It's a bit long. And also we have that Facebook group too that's free with a lot of information we could link in the comments too. Dizziness, neck pain, and TMJ is the name of that. So that's how they can get in touch with me, and I'd love to talk to anybody out there struggling with dizziness and doesn't know where to go or just feeling really confused about what's happening.
Yeah, so I would like to just give you an idea, guys. So yesterday, Sarah and I were talking. She's very gracious to really give me valuable information and advice about my current situation. And what's really fascinating, and she saw me doing this while I'm listening to her, and she said that is a trigger. Propping, and that is putting pressure on your jaw, which is this is the left side. And I was like, dang, I never even thought about that. And she mentioned that we were in that training for 4 days, and how many hours a day? 5, 6, 7 hours a day. And I bet I was propping because I'm writing with my right hand and I'm propping with this. And maybe that really, trigger the tinnitus, the ringing in my ear. Okay, so simple things like that, the proper sleeping position, and different practical tips actually that you can learn from her that will maybe save your life and bring back the good quality of your life. And Sarah, tell them about because I asked you about success stories. Being a patient right now, my fear is this is going to be forever. I told you that, and a lot of your patients also ask you about that. So tell me, what did you tell me about the fear of this being forever?
Yeah, I think that's the worst fear, when you're in the middle of a dizziness thing, you can't imagine living like that, and I've had it, myself. I've chronically managed it 11 years. It's been under control, thankfully, very well. But, life happens, stress happens. Thankfully now, if I have an episode, I can nip it about 5 minutes and it's done, So it is something like headaches that you manage, you deal with. But, we'd never say you'd never have a headache again. Just like we'll never say you will never have dizziness again. But if you can keep it under 5 minutes, it's very much, you're living your life. You're not worried about it. You're not in fear of it. You've conquered it, and that's my goal for all my patients, not that they'll never have an episode again, but they'll have just a flicker, or they'll recognize, some warning signs of it starting again, and they can nip it in the bud. And, really what started me on this journey was I had a 15-year-old come into my office, and the mom was just in tears almost, right? And he'd been dizzy and in bed for like 3 weeks. And he'd seen a pediatrician, cardiologist, neurologist, and then an ENT before he came to me. And the mom was just like, they can't find anything wrong. Like, he can't even go to school. He can't play baseball, all this stuff. Like, I don't know what's going on. And first of all, the whole time he's in the evaluation with me, he's on his phone, like hunched over, right? The whole time. And I'm like, well, did anything happen like the day before you had this episode? And she said, yeah, well, we drove back from a trip, that was it. And I'm like, how long was it? She said 8.5 hours. I was like, well, there you go, right? So he'd been over that phone hunched down for about 8.5 hours. So quickly I said, this is probably cervicogenic, coming from the neck and your posture of your head. And we gave him the stuff, and the next visit was planned in a week, and she called and canceled. She's like, he's got a baseball game. I'm like, okay, so that's great. What's going on? And so I called back and found out that, yeah, within a few hours of our session and me just telling him what to do, his symptoms were already improving. And it was really just a relief of his mind that this was nothing life-threatening, and the posture exercises and retraining, everything I gave him. So a young 15-year-old, like in a week, he was better, and other people it might take longer, but usually within a month, people are really feeling pretty good if they're doing the right things. And yet people in this group have been suffering for years, and people I've seen have been suffering for years. So I just really became on a mission at that point, a turning point, like we got to get education out there about this diagnosis, because people are just not getting it. So, I do think it's super treatable and super beatable, like honestly, like with the right things, and they're not hard things, like King knows, I told you some of them yesterday, just recognizing what these triggers are that we don't even realize. We're sleeping on our stomach and we're cranking our head, or we're propping our hand, or watching TV with it just to the left, so our left neck is getting really tight. Just all these little triggers that I've heard in stories over the years. So, like I can recognize them quickly because I've heard so many times the same stories. But they're not hard, to implement, the good stuff. So it's my passion. That's why I'm in it,
Yeah, that's awesome. I just need to clarify, you guys. So if you're having, of course, dizziness, the headache, of course, the best thing is to talk to your doctor about it, and just like Sarah said, some of our patients been through different medical professionals, and as long as they rule out that it's not something in the brain, that's one of the most common fear of dizziness,
right.
Is it coming from inside my brain, and as we all know, the cancer word is very scary. So we have to cover all the bases, and so if, for most patients that have been cleared and still they don't have any answer, that's when the teamwork will happen. The physical therapist, just like Sarah, specializing in this, dizziness, headache, and TMJ. TMJ is your jaw joint here, can come in and help you with that, like cutting off the long journey of trying to find the answer, the solution for your problem. Okay, so any last words, Sarah? By the way, guys, so if you cannot make it to this boot camp, just keep in touch with Sarah. She will be having other boot camp, within the year. So when you go to the Facebook group, she will post her, latest boot camp or any workshop that she will be having there. So, just get in touch with her, and so you can have her information and her email address. It all will be on the description section. Okay, Sarah, last words.
Yeah, just to be encouraged that this is not a lifelong debilitating illness. It's very treatable. Headaches, the neck pain, TMJ, dizziness, all of it is so treatable. And reach out for help because I want to help you, defeat this thing.
Awesome. All right. So thank you guys for watching. If you have any other questions, clarification, suggestion, comment, just put them on the comment section down below. Again, all the information, the link will be down on the description section of this YouTube channel. Join Sarah. What's the name of the Facebook group again, Sarah?
It's called Dizziness, Neck Pain, and TMJ.
Okay, Dizziness, Neck Pain, and TMJ Facebook group. It's so just join that group. Email Sarah if you have any other question. Join the boot camp that she will be having this week. Share this information to anyone you know. I bet you know someone who's having headache, migraines, dizziness. Share this information, share this video to everyone you know. This is a valuable information that she will be giving away in 3 days, guys. So I highly recommend that you attend the boot camp and reach out to Sarah. Okay? Thank you so much, guys, for watching. And as always, until the next video, stay blessed.
Thank you, Jane.
Thank you.